Okay, so today we're going to talk about the gross motor function measure, the GMFM, and specifically we're going to talk about section 4, which involves standing. So the purpose of the GMFM, or why it was designed, was designed as a measure to show change in gross motor function over time. It was developed to be used in children with cerebral palsy, but it can really be used with children that may show any form of developmental delay. It's also been shown to be useful by therapists to describe a child's current level of motor function, used to determine treatment goals, and to provide easy explanations to parents who may be concerned about their child's level of function and progress that they may or may not be making. The assessment includes 5 components to motor function: lying and rolling, sitting, crawling and kneeling, standing, and then walking, running, and jumping. All tasks are designed so that a 5-year-old with normal motor ability should be able to complete each task. Another nice thing about this test is that the test assesses whether the child can perform the task or not, and does not show or look for the quality of the performance of the task. The time required to complete the full test should be approximately 45 to 60 minutes. It can be performed, half on one day and half on another day, but it shouldn't be spread out more than a week in time, for fear that they're already making progress in that week. The child should be dressed in shorts and a t-shirt so that you can see their feet and their legs. They should first be tested without any assistive devices, and that includes orthotics, which includes shoes. So the test should be performed without shoes. It can be performed without the assistive device, and then if the child normally uses an orthotic or an assistive device, it can be performed again with the device and scored on the same scoring sheet, and then also separated out as well. Each task has the child begin in a specific position and then perform a task out of that position, and the scoring is basically scored on a 0 to 3 scale. So 0 would be the child cannot perform the task at all. 1, the child can perform 10% or less of the task, so they can initiate the task but cannot necessarily perform it. A score of 3 would be they can perform 10% up to 100% of the task, so they can complete a majority of it but not complete the full task. And then a score of 3 would be that they can complete the entire task. So what we're going to do is we're going to do a test patient here. And this is Reed Marshall. This is his consent form signed by his mother, and then signed by myself. And so the child is 4 years old, and a diagnosis would be mild cerebral palsy. So we're going to use this manual, this gross motor function manual, and we'll take him through the test and score it as we go, and then at the end we'll go over his results. So Reed could you please lie down on the floor? Or just sit right down on the floor. Good. And now can you go ahead and stand up from the floor, and you can use this to pull yourself up if you need to.
Okay.
Okay, good. So he was able to pull himself from the floor to stand at a large bench. So he was able to perform the task, so we'll score him a 3 on that. Okay, Reed, now could you stand back up? Good. And stand right there. Can you come this way a little bit? Good. And stand right there. And I'm going to time you. I'm going to count in my head. Okay, so he was able to stand for longer than 3 seconds, arms free. So he'll score a 3 on that. Just hold on 1 second. And he was able to stand for longer than 20 seconds. So we'll score him a 3 on that as well. So now, can you stand next to this mat right here and hold on with one hand, and then raise your right leg, raise your right foot up off the ground. Okay, now can you raise your other foot up off the ground?
How can you do that?
Can you put that foot down? And now raise your other foot up in the air. Good. Good. So he was able to stand holding onto a bench with one hand and hold his right foot off the floor for greater than 3 seconds. He was also able, okay, you can put that foot back down, right? He was able to hold his left foot up without holding on, or while holding on for 3 seconds. So now, Reed, can you come this way a little bit? Good. Now, can you stand on one foot? Good. Stand on one foot for as long as you can. Good. Now, can you stand on your other foot? Good. Try it one more time. Okay. Take a break there. Okay. So the test was to be able to stand on one foot unsupported, or without use of the hands for 10 seconds, and he was able to stand for approximately 4 seconds on each side, which is greater than 10% of the 10 seconds, so I would score him a 2 on each of those. Okay, Reed, we're almost done. So now, can you sit down on this small bench right here? All right, and now can you raise your arms up? Good, and then can you stand up without using your hands? Okay, and then sit back down. Good. Can you stand up again, but without using your hands? Okay, sit back down. Good. Hold your hands up here. Good. Now stand up without moving your hands. Good job. Okay, so he was able to stand from sitting on a small bench without using his arms, so I would score him a 3. And also, you can relax, Reed. With this test, the child is allowed to have 3 attempts. They cannot be assisted. You can assist the child into a starting position, but from there, no assistance. You can give them up to 3 tries to get it, but then if they can't, then that's what they'll score. So now, almost done. Can you kneel down on your knees like this, Reed? Come right here next to me. Good. Right up on both knees like this.
Okay.
Good, hands up. Okay, can you come right up high on your knees like this? Good. And now can you stand right up without using your hands? Good. And then go back down. And now can you do it going with your other foot. So your other foot up there. Other foot. Good. Other foot. Good. Stand right up. Good. Okay, so Reed was able to stand from a tall kneeling, going through a half kneeling on each leg without using his arms. So I would score him a 3 on each of those. So now Reed, can you, if you're standing there, can you sit down on your bottom? Sit all the way down to the floor. Good. And then come back up again. Good. Now can you do it without using your hands to help you? So go sit back down on the floor without using your hands. Good. Okay, come back up. Try it one more time. Sit right down on the floor without using your hands. Okay. So he was able to lower to the floor with fair control, but he had to use some support with his hands to lower at the end there. So I would score him a 2 out of 3. And then the last two, Reed, can you stand up? So now, can you just squat down? Good, and stay right there. Good, and then stand back up.
Are you done?
So he was able to, one more thing, Reed, able to attain a squat position without using arms, so I'd score him a 3. And then the last one, Reed, can you bend over, pick that up, and then stand back up? Good. Okay, can you sit it back down? Good. Okay, so he was able to pick an object up from the floor, arms free, and then stand back up without using his arms for assistance. So I would score him a 3 there. Okay, Reed, we're done. Okay, so in conclusion, we scored him. We'll add up all the scores.
I got videotape.
So that's 36. We're not done. Can you go for a second?
Kaylin, didn't you
So 36 on dimension D. In the end comments, was this assessment indicative of this child's regular performance? Both the mother and father would say yes. Comments. He was able to do all of the tests, so there's nothing remarkable there. So his score was 36 out of 39, and I would have to get a calculator to calculate that, but you would come up with a percentage, and then you can come up with a goal percentage, and then check whether they've met that goal or not. As I mentioned before, you can also, if they typically use an aid or an assistive device, you could have them perform the measure again and score it. On this sheet, you would use the same score sheet. You would just mark an A for aid in the box where they use the assistive device. And the last thing, the measure, you can do all facets of the measure, or if there's one specific area, such as standing, that you want to measure, you can use just that one measurement and use that. If you used all of them together, you would find the score for each one and then average that to get your grand total score. And that is it.